You're probably here to think about the treatment options for your localized prostate cancer. What we want to tell you about today is robotic radical prostatectomy, the treatment before, during and after the operation. Well, patients with localized prostate cancer are faced with very difficult decisions because there's such a wide range of treatment options. You can remove the prostate with robotic assistance or by traditional open surgery. You can give radiotherapy to the prostate either with seeds or external beam over a 7-week period. Or some patients can be treated by what we call active surveillance, whereby no procedure is done, no treatment is given, but the patient is just watched and the PSA test measured at regular intervals.
It is a big decision for the patients because undoubtedly any surgery is disruptive to patients and it does have consequences post-surgery. So I think a lot of men find it very hard to think A, that they're ill, and B, that they have to have an operation. And many of these chaps have never been in hospital before.
And so you think, to some extent, you're invincible. And there's this massive shock, and you have to get used to that.
Absolutely knocked out. He's a fit, strong man, never get a cold, and to think that this thing that's happening to us.
And we found that the patients have fed back to us that it's very helpful to talk to other patients who've just been through the experience. So we've tried to formalise that for those patients who would benefit from it and who ask, by having a buddy system where we can put them in touch with somebody who we know who's had a good experience and is happy to help in that way.
My recovery was remarkably fast. Yes. I would have to say I had absolutely no pain at all at any time.
Robotically assisted radical prostatectomy just gives us a better way of removing the prostate. There's less bleeding, there's better vision, the instruments are more accurate, more precise, so it enables us to remove the prostate successfully without damaging surrounding structures. With robotic assistance, you can see the nerves much more clearly, you can dissect between them and the prostate much more accurately, much more precisely. So there's no question that the nerves are better preserved by this new technology than by original open surgery, which we used to do a great deal of. This is what we call the console, and we have a number of pedals here, including a clutch that allows me to move the instruments around, and a camera pedal, and 2 diathermy pedals, the right and the left one there, which allow us to stop the bleeding if we encounter any, although with this operation we don't encounter much. As I move my hands here, I get exactly similar movement of the scissors on the right and the forceps on the left. The robot gives us a number of advantages. It's got this amazing 3D vision, 10 times magnification. It's got the ability of the endo-wrist technology, it's called, where the movements of the instruments allow us more degrees of freedom than the human wrist has. So that allows us to get behind the prostate and push these nerves away. And it also helps the suturing, the stitching of the bladder back to the urethra, the joining, if you like, or anastomosis over the catheter. So it helps us in terms of accuracy, it helps us in terms of precision, and it helps us get the cancer out and avoid the damage to the nerves that can be important in terms of continence and sexual function. Well, Steve and Hilary, nice to see you. Welcome. It's just about 8 days since your operation, and you've come for the catheter removal. But before that, we wanted to tell you the pathology report, which I have here, and it is very good news. The prostate was enlarged. There was a Gleason pattern 7 cancer, but all the margins are negative, and you can effectively consider yourself cured.
Fabulous.
So, brilliant news, my friend.
Fabulous.
I'm so pleased.
Thank you.
All we need to do now is to get that catheter out.
Yeah.
So, Stephen, you're now 8 days post-surgery. Your operation was last Monday. So the important thing about today is to remove the catheter, fill your bladder up and see how you're able to pass urine and how much control you've got. This is very much a trial day. So we'll be taking the catheter out, we'll be taking a specimen of urine from the catheter to check you haven't got an infection, and then we're going to be taking out your abdominal clips. All right?
Fine.
Generally, we will see patients on a long-term basis. We see them every 3 months for PSA checks post-surgery, and then every 3 months in the first year, and then 6 monthly if PSA remains undetectable in the second year, and then annually thereafter. So it can be quite a long-term relationship with the patient.
Come in, Graham. We're
Thanks.
come and sit over here.
Okay.
Welcome. Well, it's 6 weeks now since your operation.
Yeah.
We know that the pathology was good, but we've got the PSA result 6 weeks after.
Yeah.
We have a negative, zero PSA. Zero
Oh,
PSA.
that's
So.
brilliant. Fantastic. I can't tell you what a huge relief that is, just to know that, that's the best possible result.
So we've discussed robotically assisted radical prostatectomy and the follow-up care, and you've met some of the team. I hope this program's answered any questions that you have, but if there are any queries, please feel free to contact a member of our team.